Welcome back to our channel. Today we are going to talk about European Authorized Representative, also known as the EC Rep. Before you dive into the black and white of the regulation, let us give an overview of all the requirements, roles and responsibilities concerning the EAR through a typical client inquiry resolution at Maven.
What is a European Authorized Representative?
Authorized representative means any natural or legal person established within the Union who has received and accepted a written mandate from a manufacturer, located outside the Union, to act on the manufacturer's behalf in relation to specified tasks with regard to the latter's obligations under this regulation.
So, who needs a European Authorized Representative?
Well, the definition indicates that companies that are located outside the European Union, wishing to sell their medical and in vitro medical devices into the European Union, would require a legal representative based in the EU. Unlike yours, if a company is based inside the EU, it need not appoint a representative.
Aha! Interesting. So how do I select a representative for my organization?
Well, that can be tricky. When selecting a representative, you need to ensure that the person is a natural or legal person established in the European Economic Area, EEA, European Union, EU, AMP, European Free Trade Association, EFTA. Secondly, since they shall act as your main representative, you would not want to hire a newbie, and would require them to have some experience in the medical device quality and regulatory field. Moreover, the new regulations also mandates a minimum qualification a representative must hold in order to verify that the technical file and other essential documents have been drawn up, and that the manufacturer has complied with his registration obligations. Most importantly, the EAR should have registered themselves on UDMED and have a single registration number issued by the competent authority from the actor registration module.
Additionally, each authorized representative has to have its own PRRC, who possesses the requisite expertise regarding the regulatory requirements for medical devices in the Union. The requisite expertise shall be demonstrated by either of the following qualifications: a diploma, certificate or other evidence of formal qualification, awarded on completion of a university degree or of a course of study recognized as equivalent by the member state concerned, in law, medicine, pharmacy, engineering or another relevant scientific discipline, and at least 1 year of professional experience in regulatory affairs or in quality management systems. Alternatively, 4 years of professional experience in regulatory affairs or in medical device quality management systems can also be accepted.
Can I be my own EU authorized representative?
This question is really interesting, and my answer is yes. For example, your company is based in India and you decide to open an office in Germany. The German office can be your authorized representative. To be honest, this would be the best scenario with only one condition. You need to have a regulatory compliance person at this office. The objective is not only to have a European address but also to perform all the tasks of an authorized representative.
What are other responsibilities taken care by the EC Rep?
Well, the EC Rep shall assist in the following activities. Firstly, review the documentation and keep it at the disposal of competent authority. Secondly, ensure that the manufacturer is complying with the registration of the unique device identification according to Article 27. Make sure that the registration of the device is performed according to Article 29, and that the registration of the manufacturer, authorized representative and importers are done according to Article 31. He or she is also responsible for communicating with the competent authorities and be available for audit support, give information and documentation in regional language where necessary. Assist in preventive or corrective action taken to cut or mitigate the risks posed by devices. Immediately tell the manufacturer about complaints and reports from healthcare professionals, patients and users.
Is there any way that I can maybe ditch an authorized representative?
I'm afraid that is not possible. The notified body will not issue your CE certificate and you cannot legally market your product in Europe.
Why cannot my distributor be my authorized representative?
It is possible to appoint a distributor as your authorized representative in Europe. However, it is not recommended because most distributors are not prepared to fulfill the mandatory responsibilities of the EC rep. Instead, select an independent representative that focuses on regulatory affairs rather than sales and marketing.
Do the authorized representative details appear on the product?
Yes, you must list the name and address of the authorized rep on the product label, outer packaging, and/or instructions for use. The name and address of the authorized representative should be shown next to the official EC rep logo. One important risk having your authorized representative detail on your product is when you want to change him, it can cost you an arm and a leg. Because you'll have to change all your labeling, packaging and instruction for use. Tell the competent authorities and your notified body. And change the marketing material.
Looking at all the stringent requirements, I believe that the competent authorities can even audit the authorized representative.
You are absolutely correct. A competent authority can inspect an authorized representative at any time to determine if they understand their role, have direct access to client documentation such as the technical file and design dossier, and have processes in place to ensure it can fulfill its role as an authorized representative.
Well, before we depart, I had one last question for you. Would you mind?
Not at all. Please feel free to ask.
Can I change your authorized representative after I appoint one?
Yes. You may switch your EC rep without invalidating your product approvals in Europe. In Article 13 of the MDR, you learn how to change your authorized representative. However, keep in mind that because your EC rep must be printed on your labeling, switching can be costly, as you will need to change labeling and deal with the issue of products that are already on the market. Also, you will have to inform the notified body and the competent authority.
Thank you very much. That was a very informative session and I can now understand the role of an authorized representative for my company.
We at Maven always believe in empowering our clients. The more well-versed the client is to the regulatory requirements, more streamlined is the process to obtaining certifications.
How do you help your client in this?
We suggest potential EC rep and their details to our clients to choose from, and if required, carry out all the formalities to appoint the same for them.
Very well then. I shall get back to you at the earliest. Thank you.
Thank you for watching. For further inquiries, please do contact Maven Profcan Services, your one-stop solution to all regulatory requirements.